An important guest awaits.
Absolutely. Democrats on the House Energy and Commerce Committee finally strike a deal with conservative Blue Dogs to reduce the cost of that big health care bill being proposed. But is that enough of the chopping?
Congressman Eric Cantor is the minority whip, and he joins us right now. Good morning to you, Congressman.
Good morning. Good to be with you.
Now, I have a feeling somehow, just in the back of my head, that you're going to say that the new deal that the Blue Dogs came up with, at least some of the Blue Dogs, that you don't think it's enough cuts.
Well, in so many words, Gretchen, I think I would agree with you. There is just a little nibbling around the edges here, and some have even suggested it may be a little kabuki dance being played to try and get some reason back into this bill. But I tell you one thing, after reading the preliminary reports of what's in this deal, there is likely even a larger bipartisan majority against the plan right now than there was even yesterday.
Wait, how could that be? Because they said they cut $100 billion out of the $1 trillion proposal. They said that they have a situation now where the public option will be forced to compete and bid on against private insurers, and they're going to postpone it until September. How would that create more friction?
Well, I think, first of all, the one good thing, Brian, that you talked about was that maybe we're going to slow down here and begin to read the details of the proposal and let people in this country have a look at what's actually being proposed. But we know now what happened last night in the Progressive Caucus. There's Barney Frank and there's George Miller and others who became very, very excited now about what was being done and what was being given by Chairman Waxman to the Blue Dogs. So you've got now, I believe, a revolt on the left in the majority caucus as to their perception about this public plan.
Right.
But let's remember, you know, the government option was always that. But we believe very strongly you can never have a government compete with the private sector and have an even playing field.
Yeah. You know, and we should point out, Congressman, when you say Barney Frank was excited, he was one of the progressive members who were like, hey, wait a minute, we can't vote for this because we wanted we wanted a big government program, and this is not it. But let me tell you, the Republicans have been very effective at slowing down the runaway train, because a brand new Wall Street Journal poll says that 42% of those in the United States now think that this is a bad idea. 42. Only 36% think it's a good idea. And a lot of those people, Congressman, when you guys go on vacation during the month of August, they are going to say, hey, Congressman, hey, Senator, let me tell you why I don't want you to do this. So do you think that also will turn some heads when people get their ear chewed on this August?
I don't think there's any question about it, Steve. And really, it's almost like a saving face attempt here on the part of the majority, because before they leave, I believe they want to have something out there. But you're right. What that will do now is cause a lot of discussion about really what's at stake here. And if in those poll numbers, I think you will also see only 1 in 4 Americans really believe that this plan will reduce costs. And you know, those Americans, those 3/4 of Americans who doubt that, I believe are right. How can we see government expanding its role in health care and somehow bringing costs down? It just doesn't make sense.
Yeah.
Do you think that the Democrats, at least in the House, really will listen to the Republican ideas? Because it seemed that President Obama really wanted this to be a bipartisan effort, but has it been?
Well, no, not so far, Gretchen. We're really trying to say, look, come on, let's speak to us, let's work together. There have been a lot of discussions on the part of members at committee level. And look, Republicans have a plan. We believe in saving tax-free for health care. We believe very strongly that you ought to have flexibility in the insurance laws so people don't lose their insurance coverage if they lose their job. We also believe that individuals and small businesses should be given the same discount as the big guys are getting in terms of purchasing health care. We've got a variety of proposals on the table, and I'm hopeful once we break for August and we have these discussions in forums around the country that maybe we can knock some sense back into the direction that this plan is going in.
Yeah, good luck. Hey, where are you going on vacation?
Well, listen, there's not a lot of that, but we're going to spend a little time in the Middle East and then actually at home in Virginia to do actually what we've been talking about, to talk with the people that I represent that elect me to be their voice, to see what they're saying as far as this health care plan.
Sounds relaxing. All right, Eric Cantor, Congressman from Virginia, we thank you very much for joining us. Thank you, sir.
Thank you.
Yeah, if you want